Rogers TV.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers Cable or Rogers TV.
Welcome to another exciting episode of In Conversation with Alethia. I am your host, Alethia O'Hara-Stephenson. In each episode, I sit down with amazing individuals from our community who are doing incredible things, inspiring things. The show will educate, it will empower, and it will inspire you. On this episode, I am honored to have an incredible trailblazer, a leader in our community, a pharmacist, Sanjay Lekhi from Shelburne Pharmacy. And so he is here to talk about his legacy, why he started in the pharmacy business, and of course, very important, his annual Sick Kids fundraising initiative. So welcome to the show, Sanjay. It is an honor for me to have you.
Thank you for having me here, Alethia. It is great to see you.
Yes, likewise. Listen, this conversation is long overdue. I think we connected earlier this year, and just circumstances we weren't able to connect, but here we are now, and I'm so honored to have you here.
Thank you. Happy to be here.
Amazing, amazing. Now, I want to talk about, tell the story, your journey into pharmacy, and, how did you get started? Was this a childhood dream, or just, many professionals that I interact with, oftentimes they say, I landed in this career by accident. Was that the case for you, or you always knew that this was where you wanted to be?
I wanted to be in the healthcare field, for sure.
Okay.
And I always wanted to be of any help to at least a human being, where I can do, which is the most important thing, the health. So, and then our anatomy and our whole system, that just gives me so much insight, like how beautiful the system is created by Almighty.
Right.
So, and then so we should take care of that, or at least help other people which we can. So that was something which I know that I was in grade 12, and I was reading some books like botany, zoology, which are like science books in. It was in India at that time. So, and that was, so it was very interesting, everything about them. And then my mom and dad had a very deep interest in plants. So we had a big size porch outside, and then they had like so many kinds of plants in the potters, or like we had a sidewalk where we used to have like seasonal vegetables. So eggplant, lemon, mango. So it was like amazing. And then once I was reading, like I had in my class, botany class, our teacher said, okay, how many, can you get as many pieces of plant leaves as possible? I had there at my home. So I just got that individually. He was really surprised that somebody can do that much. And now that part, my wife and my son, they are so much into plants, and then our house is full inside of, I don't even know the names of those, but that is really good to see that. And it gives so peacefulness inside the home.
Yeah.
So that part was there. It was just a starting point for me at grade 12, and then I studied for some exams. Then I went to university in India, which we did the 4 years university program. So then I landed in a place where we used to manufacture medicines. So like eye drops, injections, small like 2 mil, 3 mil injections. And then, so I did that for probably 7, 8 years. And then, so suddenly mind clicked, okay, you know, there is more to explore.
Wow.
So how about just going to Canada? So, and then I said, okay, but if I don't get settled there, if I have a lot of problems there, what do I do? I'll come back. I will pull my, you know, resume my the same job, or my employer was not happy that I was leaving, but I had to try.
Right.
You know, and so I struggled. I did some odd jobs, worked in Tim Hortons, this, that, you know. Did a job in a company which manufactures medicines here, like capsules, tablets, and all those. So, and I enjoyed that part as well. Then I was also writing my exams as I going through.
Wow.
So, and then sometime I had a evening shift or a night shift. Then after 2-3 hours of sleep, then I would go to university and study there for the day, come back, sleep for 2-3 hours, go back to my work.
Oh my gosh.
So,
and see, at the beginning of the show, I said you're resilient and you're adaptable, and I didn't know the story.
So today, if I go back, I don't know how I did that.
Wow.
So I think it is because you know, you have, my son was 2 years old when we came here, and then, okay, you have to put food on the table, you have to do something. So I know I have to study, but I have a family as well.
Absolutely.
So so it was not easy, but I am so happy today that I did that. And this is a very good lesson for my kids. And they also see, there are some magazines which posted my interview and all those at that time. And I still remember my son called me, was working, "Dad, you're on the front page." I said, "Where? Which front page?" "Front page of the magazine," as if before it was not on the mobile phones, right?
Yeah.
And he was just looking at the thing and then talking to me. "And then center page as well, Dad." So, okay.
Beautiful.
So
Talk about a legacy that you were able to leave behind, right?
Yeah,
That's
thank
amazing.
you. I was it was the strength, you know, it is given to you at that time to do that, because it is your moment to do that.
Wow, powerful, powerful.
Yeah.
And we're so blessed because of, you know, that transition. I'm sorry that you had to leave your employer back home, but the fact that you're here in Canada, we're all richly blessed by that. So thank you for making that decision.
Yeah, I'm really happy. Sometimes I feel that I am meant for this country, because, you know, right away when you have connection, you know, you have connection with each and everybody who comes to your pharmacy, you have a certain kind of connection. One person likes to treat or deal with in different manner, other person do a different manner, but we are so adaptable. Thank you for that word which you said. That I enjoy every moment of my time at the pharmacy. And then, but the other thing is that, like, you feel good that, okay, at least you help somebody with their most important thing in the life. So I know that how, when somebody is sick, coming to just want, if somebody just helped me to get rid of this problem, and it'll be so good. So you kind of a part of that, and then you feel blessed.
That's amazing. And so here you are now as part of a small town community. You could have settled anywhere, right? But you chose Shelburne. And I know, you know, in some of the interviews that you've done in the past, you talked about, you know, something special about Shelburne. What was that thing? What was that special moment that said, yep, this is where I'm going to make my pharmacy, you know, permanent?
That is exactly what I felt that I meant for this country when I switched to, when I moved to, like, work to Shelburne. So I did my exams, and then my first job was interned as an intern. It was in Loblaw. So I did my internship in Loblaw, and then they posted me to. They gave me a few options. So Shelburne was the most closest from Brampton at that time. I was living in Brampton.
Wow.
So and then that way said, okay, it's an hour commute, no problem. So I used to come here. And then I loved how everybody greeted us and then treated us and then had trust in you. And then, there was, I still remember, Loblaw had like few stores, like 10 or 12 stores, and they were nominating the pharmacist of the year for that total like stores. And I was fortunate that I was selected as, and we were the first winners up in the nomination. So we won that. And then because of the customers, right? It is not they wrote the comments about me. They wrote, okay, they felt this way. So and I was not doing anything different than I needed to or I have to as my profession, but other people felt that this is more personal.
Yeah. It's that certain level of care that you provide, right? It's not just, dishing out, prescriptions. You have that bond, and sitting here having the conversation with you, you have that natural ability to connect with individuals, and I think that's quite powerful.
Thank you.
I think it's more than just the fact that you're able to, treat someone. It's that relationship that I think you're able to have with your customers. So kudos for all of your accomplishments to date.
Thank you. I think everybody needs like more respect.
Yes.
When you do that, you automatically get that back. There is not a rule or you have to invent a wheel to do that. It is just so easy to do. So and then so simple, so easy, and so rewarding.
Absolutely, that's amazing. That's beautiful. And so you're doing pharmacy, and 9 years ago you decided to start a fundraiser in honor of sick kids, or to raise funds specifically for sick kids. What was the inspiration behind that? Why did you feel the need to start a fundraising event?
That was because we used to get a lot of prescriptions from the sick kids hospital, and I never went to sick kids hospital. And when I used to talk to the customers, okay, what made you go to sick kids hospital, they kind of tell me the stories which you can only watch movies or see in movies or watch in movies or hear in movies. So and I was so surprised when they say, okay, sick kids took care of that. I thought, wow, so amazing. An hour away from us, there is a hospital, which is like, aren't we so lucky that, people from all over the place, they go to sick kids. We are only 1 hour away, so how can be of any help to that hospital?
Right.
So, and then it just, that on-off switch,
Yes.
the switch got on, and then, okay, let me do something, but when should I do it? So when most people will be around.
Absolutely.
And the weather is a little bit more adaptable. So I selected like somewhere around May to 4, something like that, because after June, people are away.
Right.
So they already booked their plan, they're
Makes
away.
sense. Okay.
And then, so that was the thing. We're looking at people's real-time thing, like real prescriptions, real problems. Yeah.
Awesome. I love that. And we're going to pick up the conversation when we return after a short break. So this is In Conversation with Alethia. I'm here talking with Sanjay Lekhi from Shelburne Pharmacy. We'll be right back.
One of the great advantages of partnering with us at Rogers TV is the access you get to production resources and expertise. So whether you're already producing videos but want to share them with a larger audience with the local community channel, or you're starting from scratch with the desire to learn and try your hand at getting the camera rolling, we've got you covered. Best of luck, and we look forward to hearing from you and your amazing ideas.
This is Rogers TV.
Welcome back to In Conversation with Alethia. I am in the studio with Sanjay Lekhi from Shelburne Pharmacy, and we're talking about the annual Sick Kids fundraiser that he's been doing for over 9 years now in the town of Shelburne. So the last conversation we had, you were inspired by the number of prescriptions that you were filling, for children, and so you realized that there's an opportunity. And so 9 years strong, what has that impact been like, being able to raise funds for sick kids?
The first, actually it is the 10th year, which we just finished.
Amazing.
Last year.
Congrats.
Yeah, thank you. So first year was kind of a write-off because it was just getting there, and then I was very new, so people didn't know me very well, but I wanted to do that. So I said, okay, no problem, at least we started. So, and the next year was really good. So I still remember that I was outside and doing some like coordinating some games over there, some barbecue was there, some this, that. So, and then one lady came, her name is Brenda Haynes. She's from the Shelburne Transporter. She drives people for medical appointments. So she said, what are you doing? I said this. She went home, she brought like R2D2 something.
Okay, yes,
that was that. So, and then she got ice, she got some Coke, Pepsi, everything in there. So she said, okay, I am going to be a part of the Sick Kids fundraiser from now onwards.
Oh, beautiful. So,
and since then up till now, without her, I cannot even imagine doing it.
Amazing.
Because she is just, she coordinates everything for me. This name is Shelburne Town Pharmacy, but the work behind that is her.
Amazing.
So, and so we raised, I think, I don't remember the exact figure, I think $3,000. So for small thing, and people came, okay, and I was really looking at, okay, burger, very good, people are doing burger. So it is $1. Wow, I'm getting another $1 again,
yes,
$2 again. Pop, okay, $1 more. Ice cream. So, and then some games are going, some dance. I have a dance studio there. Somebody turn it out. That's a dance studio. So she has students learning the dance. So she said, okay, she can put something from the kids side, and then kids had a dance show, so something like that.
So a real community effort, right? So here you have just an idea, the light bulb went on, and now you have, all of the community around you celebrating and making sure the event is a success.
Absolutely, it is so true. And then I approached most people, okay, do you want to do that in Sick Kids fundraiser? Sure. Elvis impersonator. They came 2-3 times, and this was real big hit because everybody enjoyed that.
Right.
And then there are feral cat rescue, bringing the cats, and some people adopted the cats from there when she came.
Wow.
So incredible, like the support from the community was just huge. And then it gives you encouragement that,
absolutely,
every year, okay, I wanted to do this, next year we wanted to do that. We just make plans.
Right,
it feels good to give it back to them. So I think around with all those years, we raised more than $25,000.
Wow.
So, and that was a big amount for a small person or a small community.
For a small community of less than 10,000, right?
Yeah, exactly.
That's incredible.
It is. I hats off to everybody who participate in that, who come and then who support us by buying the stuff and things.
Brilliant. And so all of the funds raised go directly to sick kids?
Yeah, so we have, when we collect the money, so we give it a count, post it in the paper, as well as inform sick kids that this is the amount, who is going to be in favor of whom. So they tell us, okay, put in sick kids foundation.
Right,
So
right.
we make a draft, give it to them, and then so we have a tally of all the years.
That's wonderful. And, one of the things that, I'd have to acknowledge is the fact that sick kids, gave you a full endorsement to have this conversation,
Absolutely.
right? So
Yeah.
that is absolutely amazing to see and to know. But above and beyond that, it's the impacts that you're having on these young lives.
Yeah.
Right. Have you had any opportunity to meet any of the children who have been directly impacted by any of the fundraising events that you've been doing?
Many.
Oh my gosh.
Yeah.
Wow.
And that is how you wanted to say, it transforms your, thinking into practice.
Right.
So, okay, I really want to do it. I am on the right track. I'm doing the right thing, because children, they're born of no health conditions on their own. They are just, they're born. We have to help them in one way or another. So they don't make any bad choices.
Right.
So adults, on the other hand, okay, we can say, okay, we made a bad choice when we were in 20, 30. We are paying the price for that. But kids, no.
In a sense,
So, and then that is why I always find that we wanted to help those who are in need, and then just continue to help whenever.
Right. Wonderful.
Whichever way I can.
Now, so you're in your 10 plus years now, and what are your hopes and dreams for even next year, thinking ahead, and the further years to come? What do you hope and dreams?
So we are very lucky that we have the paramedics and fire people. They come, they show their vans, they show their trucks to little kids. So I just hope that a community like that is going to come forward, and then more and more people come. Town is growing, so
Yes.
I wanted more and more people to be a part of that, so that we can have a good $5,000-$7,000 amount we can raise, and then keep on giving more and more to sick kids, so that everybody can get help.
I love that. I love that. Now, you've been able to do this now 10 plus years. What is your legacy that you want to leave behind? What message would you want to leave for your children in terms of possibilities?
So I'm very glad that my children, they always help me when I'm doing that. So last time they had a car show. My son has a sports car, so his friends have sports car. They come and they show their cars. So this is one way of telling them, okay, we are in there together. And then so they like it. Sometimes they go and deliver the check, so they know how important it is, and they get a tour of the sick kids hospital there. So what I wanted to say and encourage them is just keep doing the way, whatever way or means you can do, even if after I leave. So maybe they can give a monthly, or they can participate on their own. They can continue this Shelburne Town Pharmacy's like fundraiser. So maybe in a picnic spot, maybe in whatever, so that so the money can be raised and then given to the where it is needed.
Amazing. Now, I believe your son also works at the pharmacy now as well, so the legacy is already carrying on. That's amazing.
Yeah.
And how can individuals support the cause? Is it only an annual event, or can they connect with you separately any time of the year to make a donation?
Yeah, they can come anytime. Actually, people come. So sometime I have a gentleman, sometimes he said, okay, $50 for this sick kids, $100 for sick kids. I said, okay, buddy, you need to have money for yourself as well.
Yeah,
So I
yes.
said, no, I have enough. I have enough for myself. So people can come. They can give $2, $1, $5, whatever they can afford, whenever they can afford. The jar is always there, and then we accumulate that for the next year one.
Wow, that's brilliant. And so Now you've established this noble cause. How do you feel about, the opportunity that you've been able to inspire others?
A lot of people are very happy. They wanted to help, and then they say, okay, we wanted to continue to include in your sick kids, but we also do other causes. So some people there have their own commitments much earlier than I started. There's some people do golf tournaments, some people do this, some people do that. So, but I encourage everybody to just, if very small portion of their salary or the wealth, they should donate back to the community. So I think so there are a few places or events which started every year, and then it is very good to see that everybody's or people are interested in giving back to the community.
Yeah, that's beautiful.
Yeah.
Now, I want to shift a little bit and talk about, at the beginning of your conversation, you talk about botany and, the number of plants that, your parents had. Did you ever consider naturopathic medicine as an option as opposed to the path that you're on now?
I believe so much in naturopathic, Ayurvedic, which is the traditional, and herbal plants, because most of the things Almighty has given in our system, plus given in abundance around us. It is, but because we want quick fix. So that is why we have to do that. Life is so fast, and there is not a cure for everything in any one discipline in the medicine, right? But I think that naturopathy is one of the best things the nature has provided us. So we just have to be more patient in that.
Wow. Okay.
So.
Interesting perspective. I like that. And, the fact that you're able to talk about naturopathic medicine while also, being a pharmacist is absolutely incredible. Now, if you were supposed to look back at, the young Sanjay in grade 12, what advice would you give to him?
So I would say just follow your dream. So anywhere in the world where you needed to go, if you can go. So if you have a means to go. So the typical example is the sick kids fundraiser. So I said, okay, we'll start it. But I could have only said that or thought that
and not do anything
about that. We just have to put one step, and then things happen, things mature.
Brilliant. So. I love that. I love that. That's a perfect way to end this segment, Sanjay. Thank you so much for being on In Conversation with Alethia. I learned a lot, especially about your Sick Kids fundraising initiative. So thank you, and thank you for all that you do in our community.
Most welcome. It was a pleasure being here today.
Amazing, amazing. So this has been another incredible episode of In Conversation with Alethia. Thank you to all of our amazing supporters, Town Tees for designing our amazing logo, and of course, Moonstone by Myra for the amazing jewelry. Please stay tuned for another exciting episode. Thank you for joining.
Connect with us by visiting our website or email us at comments@rogerstv.com.
Think it's okay to drive high? Think again. Drug-impaired driving is as illegal as drunk driving, and in Ontario, the penalties are the same. If police